So what happens with carpal tunnel syndrome is there are muscles and nerves that run underneath a tendon, and in between these two large muscles that are in between the hands, right? So we need to lengthen and stretch that muscle, because what happens when it's overused or overworked, it starts to get enlarged, and that's where compression starts to develop, and we start to experience carpal tunnel syndrome. So we're just going to try and lengthen that muscle, stretch it out, get it to relax, so it can function the way it's intended. Slowly move the wrist back as we do strokes downwards to get that muscle to stretch. This technique is best done as slow as possible. So it's great that you decided to do some self-care and stretch that muscle so it's not so overly contracted.
And I listen my time on the computer too.
That's really helpful.
Yeah.
Definitely. Really, really helpful. But as we know, if the knots don't come out, then there's still going to be some issues. So we're just slowly but surely working those knots out.
So drink more water.
Yeah, definitely drinking more water is beneficial and necessary, really. She was talking about this one doctor who, these patients were coming in with all types of ailments, headaches. He would give them water every 15 minutes. And then their ailments went away. And so he felt compelled to write a book that was titled something like, "They're not sick, they're just thirsty." So severe dehydration really causes a lot of issues in the body.